States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Reading of the mission statement. Our mission, Macomb County Community Mental Health Quality Services, which promotes recovery, community participation, support. Aye. Any opposed? Hearing of the public. Anyone from the public? Request to approve a special assessment for the community.
See, it's not just me, it's tough.
I was not wearing my glasses, so I can't see.
I'm too loud.
Support by Julia. Tracy?
This is the special assessment that the state association was requesting. It is voluntary. That the $31,000 listed is the amount of what they would normally pay annually for our membership. We have already paid our membership. This would be in order to assist in the advocacy efforts that they've been doing over the last couple months. And I'm happy to provide any more detail or answer any questions if you have some.
Motion and support, all in favor?
Aye.
Any opposed? Item 5B, request to approve a $5,000 voluntary special assessment to support the Community Mental Health Association technical assistance for certified community behavioral health. So moved.
This is similar in the way that it's also a special assessment to support the state association directly related to leading the technical assistance with an outside partner directly related to the CCBHCs, including better mechanisms for funding, advocacy, and kind of tapping into the best practices of other states and trying to apply them and learn those aspects in the state of Michigan. So again, this one is also voluntary, but we would recommend supporting it.
All in favor?
Aye.
Any opposed? Item 5C, request to approve the state amendment to add infant and early childhood mental health consultation sub-grant agreement to the master agreement for comprehensive behavioral health 2026 between
Hi.
So moved.
by Phil, support by Donna. Leslie?
This is just, the state has decided that they are going to move this grant into our master agreement for the first time in, I don't know how many years. But so it's now part of the master agreement, which I came in September to get approved. And then we broke down all the individual grants that were included and not included, but that we are awarded by MDHHS. The grant itself was approved, but at the time it wasn't part of the master agreement, and now it is. Yeah.
Any questions? All in favor?
Aye.
Any opposed? Item 5E, request to approve the use of MDHHS approved grant funds for technology-based recovery supports for materials, programs, and software to enhance data collection, care coordination, and engagement with services and supports provided in the MCC MH network. I'll take a motion. Okay, Leslie.
So this is, again, one of the grants that we got approved as part of the master agreement back in September. We're requesting approval to spend the funds as allocated in the grant. Promotional supplies and materials cannot exceed $15,000. That includes things like rack cards for My Strength, things that advertise the technology that we have available to individuals served, including the PUP software and things of that nature. It also includes the Symmetry software, formerly known as AFIA. That funds $145,000 of that software. $16,000 is allocated for the PUP software. That goes for the entire provider network. It is free to all providers and individuals served to use, and it is actually growing in the system and doing really well. And it's enhancing engagement, so we want to keep that. And then the annual access fee for the My Strength, which is now governed by Teladoc, $16,000 of the grant funds that. And then we have $4,000 that goes to the appointment reminders that are part of the PCE system that we use for Focus, and then $4,000 for psych surveys for the DBT group.
Aye.
Any opposed? Motion carries. Item 5E, request to approve the use of MDHHS approved grant funds for integrated healthcare supplies, events, promotional materials, and evidence-based practice training for the CMH network. Support. Motion by Sharita, support by
Yes. Okay. So again, this one was part of the master agreement. We approved the grant, but we would like to approve the spending of the grant to include all of the evidence-based practices that we will be bringing to the system for our clinicians to be trained on, so that we can further enhance the availability of the best practices and evidence-based services to those that we serve here in Macomb County. It also includes, by default, marketing and promotional supplies, $10,000 for marketing and promotional supplies, supplies for individuals that include locked prescription bottles for individuals who are on, controlled substances, or who are, with small children in the home, things of that nature, or who are at risk, higher risk for suicide. So we provide those to individuals. That's $12,000. We host our annual Integrated Health and Wellness Fair. I believe that many of you received some things from Jeff last time. Those are types of the materials that we purchase for the fair that we give out to people in the community. We also provide them at other events at any point in time when individuals in our system request for upcoming events. So for instance, B, our communication specialist, is going to a homeless outreach event next week, I believe. So a lot of those materials go as well to her for that event. And that is a total of $13,000 that we're requesting approval for. And then we have our Carter kits, which are sensory kits that are available for first responders and our crisis teams to support individuals in our community who are on the autism spectrum or who have other sensory issues. So we purchase the Carter kits to give out to those crisis teams and those first responders to support those individuals in our community. And actually, I have to share this because it's really fantastic. So we went out to the Sterling Heights Fire Department to give them some kits because they already had one or two from the CIT training that we did back in July. And they were able to use them at an event that happened, the Sterling Fest. There was actually a couple of individuals in different areas of the Sterling Fest who were experiencing sensory, like an overload of sensory stimulation, one of which did identify himself as being on the autism spectrum. Officers and firefighters that were on scene used the Carter kits that we provided to support that young man, and he was able to enjoy the fireworks and stay at the Sterling Fest. So, yes. So we would like another $5,000 to purchase more Carter kits. It's paid for by the grants, but we would like approval to use that for those Carter kits to keep providing that to the community. And then our garden project, we're going to continue that. That is available to any provider in our network. We host an informational webinar in February, and then applications come in March. It's open to individuals in specialized residential as well. Actually, one of our ALS homes participates, and they do a few of their homes have gardens. They grow vegetables, herbs, flowers, things of that nature. ACT also participates, and some of our other partners, including Turning Point. And it's really wonderful the things they do with the garden. They engage individuals in creating the gardens, maintaining the gardens, and then use the food and things like that to give them to people served. So very good use, in my opinion, hopefully in yours as well, of $5,000 of that grant money for the garden project. and on to our evidence-based practice trainings. Okay, so we would like to bring the critical incident or crisis incident stress management, also known as a CISM, training back again and enhance our Macomb County CISM team because we do need additional CISM responders based on the different things that have happened in the community and the need for ongoing CISM support when individuals and entities in Macomb County experience crisis. So that will be a $10,000 training. All contracts, of course, will go to Drew and legal, and those will come when they're done to the board. So I'll be back. And then we would also like to do mental health first aid and spiritual first aid trainings. Mental health first aid and spiritual first aid would be a total of $8,500, so $8,500. That would cover both, and that would be all for supplies and materials. We do offer it for free. They are open to the public, and the difference only being that the spiritual first aid is tailored more to faith-based communities and faith-based individuals, and that would be at the request of. So we've had some clergy reach out and ask for a mental health first aid that incorporates spirituality. And so Dr. Ward, my supervisor, did some research and found this evidence-informed model as well. And it is very similar to mental health first aid, but again, it just incorporates that spiritual. So we are going to combine both because they are so similar and use that $8,500 to purchase those supplies and seats for people in the public and at different community partner organizations to attend. And then we have the play therapy training. So last year, we decided to reach out to a registered play therapist and supervisor and an expert in play therapy in the field of clinical child psychology to meet a need for treating and working with younger children that are maybe 7 and younger, because there's not a whole lot of things that some of the therapists are trained in to work with that specific population of those young kids. So we were able to purchase different sessions and modules with Dr. Hutchinson, who is the clinical psychologist and registered play therapist, as well as a professor. And we bring her to provide those sessions to teach integrating with family therapy, addressing trauma, and different modalities and treatments that the clinicians can use to work with those younger kids. And so we would request up to $5,000, not to exceed $5,000, to purchase those training sessions from her. And then we also were working last year at the request of some of our clinicians to bring what we call acceptance and commitment therapy to our system to work with some of the individuals in our system who maybe are struggling and are unable to succeed at higher levels of functioning, but teaching them how to accept where they are and build that resilience within themselves. It's actually a fantastic training, and I was lucky enough to be able to take it last year. And it really is focused on when individuals are in these situations where, maybe they can't get a better house or have a better job or have more access to certain things. How can they accept that, move through it, and build resilience? So it teaches the clinicians how to work with individuals in those situations and work them through this acceptance and commitment model. And so we were requesting $5,000 for 2 courses to host Dr. Matthew Skinta to come and provide 2 more of those trainings for us to get more therapists trained. And then we are also requesting $10,000, up to $10,000, it may not even be that much, for equine-assisted psychotherapy. Many of you may or may not be aware, they have added equine-assisted therapy to the waivers, but any child or adult who is not covered by a waiver is kind of SOL, excuse my language. So we wanted to bring something like that to our individuals who are not waiver covered. And there are, the therapists have to coordinate with us so that we can give the approval for them to go, and they get up to 6 sessions with that equine assisted. They are not riding horses, they are on the ground. It's just more about animal care and being with the animal and working through some of that. And then we are going to host one more eating disorder advanced training cohort. Last year, we were able to host a basic intro course and then the advanced course to fully provide that evidence-based practice and understanding of assessment, treatment, and referral when necessary to higher levels of care of eating disorders, including anorexia nervosa, bulimia nervosa, avoidant restrictive intake disorder, as well as binge eating disorder. So all of the eating disorders are covered in depth, and Dr. Amy Baker Dennis is the expert in the field. She's actually the reason that we have some of the advocacy programs and things of that nature around eating disorder treatment now. So it's a very much an honor for us to be able to bring her to teach our clinicians how to assess and treat those eating disorders. And then this advanced session also works with comorbid conditions. So where there's substance abuse disorder, where there's personality disorder, and how to work with the eating disorder treatment in addition to those other disorders and challenges. And then seeking safety. This is an evidence-based model for treatment when it comes to substance abuse as well as trauma. It is an all-day, one-day training, and the $4,000 is really just to pay for the materials for the staff who will come to that training. It is always requested, and we host at least one, but sometimes two a year. And so again, that's just the supplies. The trainer is Dr. Ward, so we get her for free, kind of, not for free, but we don't have to pay for her out of the grant money, so that works out. And then internal family systems training. So this was raved about last year. We brought it for the first time at the request of clinicians. We have Dr. Lawrence Wentworth of Wentworth and Associates, who comes and does a full day training on internal family systems and gives the introduction and explains the model to the clinicians. There is more that they would have to do to become fully certified, but it gives the basics of the model, the foundation, so they can implement it in their therapy and in their work with individuals to help them when they're responding to different types of trauma that they had maybe in childhood. Again, a very fantastic training. Dr. Wentworth is very well versed in and is able to use clinical examples that the clinicians provide during the training and work with them on kind of how they would implement IFS in that. And so that money, up to $10,000, would include the trainer fees and costs, as well as the books that are required for them to read prior to coming to class. And then we have EMDR, eye movement desensitization reprocessing, which is an evidence-based best practice in trauma. And Dr. Wentworth's associate is Christy Klein. She is an EMDRIA certified trainer. And so she would be coming out and training our clinicians. We will have up to 10 for $10,000. It is a pricey training, but it is a very comprehensive training. They would leave that training level 1 certified to provide EMDR to children and adults in our system. And that would also includes the training, the full week of training. It also includes the consultation hours that are required post-training for them to receive their level 1 certification as EMDR certified providers. And then the sexual deviant training. So we've had multiple requests come through for a more specialized training in paraphilias, sex addiction, if I could speak properly, and the treatment and assessment of sexual predators with children and adults, right? So grooming behavior and looking at those predatory behaviors. And we were able to find Matthew Rosenberg, who is one of the few specialists in our state that provides these comprehensive trainings and provides that has provided treatment for many years and still treats individuals who have paraphilias, which would include pedophilia, but also who have sex addiction or who have sexually deviant behavior. And so these trainings will be full day trainings. We're going to offer 2, and they are going to talk about the difference between a molester and a pedophile, the grooming behavior that parents and caregivers need to be aware of, the information and the statistics around, is it more likely to be a stranger versus a family member or a family friend, those types of things. And then he's also going to talk about the different paraphilias, symptoms and presentation associated with those, and give assessment tools and information to our clinicians on how to properly assess for some of those more concerning behaviors to determine risk and things of that nature. And we are going to be very mindful and intentional about how we promote that training. Trust us, please. And Tracy will always approve it before it goes forward. So there's that, safe as well. And then finally, our professional art therapist and the supplies for the art therapy that is provided in as an adjunct to our clinical treatment services. So we're able to open up to any child or adult receiving services with Macomb County Community Mental Health to participate in these 10-week guided art therapy sessions where the artist is guiding them in artistic expression of symptoms or of coping or of feelings, just to use as a method for self-care and self-expression in a way that promotes and encourages the work they're doing with their therapist, but it does not take the place of, right? She actually has some really good things planned for the holiday art that individuals will be participating in. And so that's free to our individuals served because we use the grant funds to pay for the artist. She's part-time, and then also for all of the supplies. And she's really, really mindful about cost effectiveness. So she does a really good job of finding really good materials for reasonable amounts of money. So we're grateful for that. And then finally, last but not least, our co-location project, which is the co-location partnered at My Care in Judson and at the drop-in center for our integrated care liaison to be present at these medical clinics and at the drop-in center to promote integrated health and wellness, to work with individuals served on identifying a primary care physician or working with their case manager or therapist if they're not already, and then giving them referrals to primary care or working to get them hooked up to the primary care offices that she's at, such as My Care, because My Care provides the primary care as well as behavioral health, and then we provide the specialty behavioral health. So they kind of work together and in tandem to make sure individuals are getting all of their healthcare needs met from physical to behavioral health. And so we have $70,000 for her, $2,000 for the cell phones and the equipment, and then $10,000 goes to pay for the certified peer that's at the drop-in centers that also assists in promoting the integrated healthcare and wellness initiatives, and also does some different activities on site with them that are related to integrated health. Okay, that's it.
Any questions for Leslie? All that sounds great.
Okay, thank you. Listen, I can't take credit for this. It's just
I have a motion and support. All in favor?
Aye.
Any opposed?
thank you.
Item 5F, request to approve an agreement with Train for Change to provide ASAM fourth training to MCCMH contracted SUD providers. I'll take a motion.
If you're not aware of the ASAM, or the American Society for Addiction Medicine, takes me a minute to remember, has a new fourth edition out, which means they've provided additional updated guidance, which means our clinicians need to be trained on that particular one. So what you would be considering for approval is the actual books and materials, but also the training on that ASAM's continuum. And we are ahead of the game, but we do have an implementation timeframe that is also required by the state, right? So we're just trying to get ahead of it before that is a requirement.
All in favor?
Aye.
Any opposed? Motion carries. 5G, request to approve purchasing naloxone bags as part of the SOR 4 grant, not to exceed $15,000. I'll take a. So moved. Support.
So you guys already had the SOAR, it was the SUD last month, right, grant, so this is part of that, so the SOAR funding. Naloxone bags are, just to be clear, it's a bag that has our information in it, and it has naloxone in it. It also has some basic first aid. It also has like a list of SUD providers, and it also, of course, has our pocket guide in there. So you're really getting this little package deal that when they're out in the community, they can educate people and also distribute naloxone.
So, great job. Motion and support, all in favor?
Aye.
Any opposed? Item 5H, request to approve the contract with Tracy Smith as and legal. Phil.
Thank you, Chair. So I wanted to bring this forward tonight. It's not fully completed yet, but it's a work in progress. We're just finessing some final technical language with HR and Tracy. But what's really different about this one, as opposed to years past, is we finally got to a 2-year contract instead of just a 1-year contract. And the plan is for Tracy to receive an increase because the Board of Commissioners has not approved a budget yet, but the plan is for a 3% increase, which would also be reflected in Tracy's contract as well. So we're kind of finessing the timing and the language of that, but I wanted to at least get the main framework to this board ahead of time so we can either approve it in November or for a full board in mid-December. But we've made significant progress. The 2-year is massive. We've been asking for that for multi-year for years now.
It took like 2.5 months this time.
Yeah, piece of cake. We're making progress. So if there are any questions, feel free to reach out to me or Megan. Thank you to Megan again. She's been an incredible help with all of this. And like I said, once I get the technical language all ironed out with Tracy and HR, I'll get it in front of you guys for the final version.
Phil's a big negotiator, everybody. Big.
Where's my hammer?
Yeah. Here, you can use this one. Okay, thanks, Phil. Any questions? All in favor?
Aye.
Any opposed? Moving on to item 6, receive and file. Item 6A, airfoil CMH communications quarter 4 report. I'll take a motion. So moved.
Just as a reminder, in front of you, we started doing quarterly reports, and this is just your media interactions. I think they do a good job of kind of highlighting what was the highlights of that, but as you can see, essentially in both social media and media, it continues to increase on all of our channels. As some early highlights, you'll see that we were featured in some additional subject matter expert opportunities, right? So what's very, very cool, if you haven't noticed, over time, you'll actually see some articles that they're talking about the subjects that fall under our area. And a lot of times they'll either use past quotes from us, or they'll put our contact information, or they'll reach out for us for a quote on a subject that really we're not the main contributor. So that shows that the local community, at least as far as the local media, now is starting to see us as a subject matter expert in that particular area. So I think that's the biggest win if you aren't picking up on that. When you do get a chance, if you haven't already, I would encourage you to kind of flip through this, because you will learn a little bit about like what our community likes to interact with. If you don't know this, when we say Happy Labor Day, we're closed. That's not a popular post. I know that shocks you. But there are very popular ones. Basically, it's most often when we have pictures in the community, and most often when we're talking about a direct event that helps the community. So we're very excited that it's unusual for us to get a lot of negative engagement. And I'm happy to answer any questions, but if you haven't had a chance, I would encourage you just to spend a few minutes looking through it so you have a better understanding of all the amazing work that goes along directly related to outreach in our community.
Not so much a question, but more a statement. I have to say, I really, I don't have Facebook, I have Instagram, but I spend a lot of my time on LinkedIn. I don't know if you guys do too, for those of you who don't know, it's the professional networking site. But I have employees in 12 different states, and I have had 2 employees reach out to me from not the state of Michigan, to my work email and say, I see you interacting with these Macomb County Community Mental Health LinkedIn posts. Like, do I have that? I live in, Iowa. Like, do I have that? So I just think it's really incredible. I think LinkedIn is probably something where we think like maybe we're not making an outreach, but I mean, you just have no idea. And I also have I'm going to call her a colleague who's a consultant whose sister recently died by suicide. And just being able, I'm so happy to hear that Mental Health First Aid is still doing it. I love the idea of a spiritual first aid. That's absolutely incredible. And just being able to say, she had a minor son contact your local community mental health. There may be resources out there for you. And, you know, before I had engagement with this board, I was a meatball. I didn't know any of those things. So it's just really cool to see this from so many different avenues. I think so often when we say social or social media in a marketing aspect, you just think of like a Facebook and an Instagram and things like that. But even on LinkedIn, it's impacting people. And even your outreach as someone who's just interacting on LinkedIn, you know, whether I repost it or I just like something, people see that and then it makes them curious. So those things, that's incredible. People from Iowa are trying to be Macomb County community mental health. Like, we're just the leaders and the best, and to hear about all the exciting things that are happening. It's just like amazing job. This is incredible.
Thank you, Megan. Any opposed? Request board approval on receiving an update by 2025 Quality Assessment Performance Improvement Program Work Plan. I will take a motion.
So I'll quaff it.
Motion by Phil, support by you, Donna. Emma?
Good evening. As part of the Quality Assessment Performance Improvement Project, the program, we have a responsibility to report to this board quarterly. So tonight we are going to report on the events data, and also we are going to report on the member satisfaction survey. And I have to also say that the state has been working through some improvements with the CRM, the new system, and also redefining what the events data needs to look like. And I have to say a member of the quality department is also part of that team that's working with the state to redefine all of these pieces. So with that said also, the quality department measures health and safety of the members by looking at incident reports. So basically, we review every single incident report that comes through, whether it's relevant or not relevant, but that's the only way we can find out is to review the report. So as you can see, this past fiscal year, we had 6,649 incident reports that came through. So out of this report, we had to categorize them in different parts. So we had 219 critical incidents. We have 297 risk events, 35 sentinel events, and 17 immediately reportable events. And out of the 6,649, we found that 6,081 was in the other bucket, which means it didn't really fit into any of these main categories that we are focusing on. And so when we receive them and we categorize them, we have some key areas that we focus on. One of the areas is the suicide-related events. So the events, the individuals who have suicidal ideation or attempt suicide or any of that, out of the CCBRC demonstration work, there's a project that's going on that they are trying to develop a system to flag individuals that are at risk. And from that, they can be able to implement a pathway depending on their risk level so that they can try to work on those individuals to get to a space where we can have zero suicide. That's the goal. And then we also look at sentinel events. We review every single sentinel events at the Critical Risk Management Committee every month. And from this event, we would request for a root cause analysis. When we review the results of the root cause analysis, we can also provide training, or we can provide recommendation to the provider or to the individuals that are involved in the situation. In addition to that, the quality department looks at trends. So sometimes we're looking, maybe we had like 5 falls in the past 2 months. We are looking to see what happened in this home. Is it a staff who is not paying attention, or is it a space that's not very conducive for this member? Then we are going to reach out to that provider to say, we have noticed this trend. Can you tell us what's going on and what are you doing? Other times we can also provide recommendation for them if they don't fully understand what it is. And the big one that we are very focused on is medication errors. So when we say medication errors, we have to refer that to the nurse administrator who actually looks critically on that to find out what the impact is. And other times he would go into the home to provide training. And I have to say, I think last week he went into a home to provide training on medication error. He also found out that they were not handling food properly. So that also gave us another opportunity for more training and education. So all of this we are doing to monitor the health and safety of the members. Some of the things that we are also finding is that providers are underreporting. So now that we have started fully auditing all our providers, we get into a home, we look at the progress notes, we see things that are documented, and we say, where is the incident report? It was either not sent to us, or they completed one, and they did not fax it, or they just did not document. So right now we are developing a process that we are implementing with providers who are not reporting their incident reports to us so we can analyze them. Then we are also finding out that like the group homes, they always handwrite the incident reports, and other times it's not very legible. So we have to go back and forth to ask more information. Sometimes they would even use like a nickname for an individual, which doesn't really help us. So that we have to go back to them to have them redo that incident report. And we're also finding out that staff turnover is causing like information, they're losing the information. So upfront, they know they have to submit within 24 hours of an incident. And then the staff leaves, a new staff comes in, they don't know what the requirement is, and then that just kind of falls through the cracks. So we have to continue to educate them and provide material for them to have in their homes as to what to do when an incident occurs. And the last thing is late reporting. They have to understand that if they don't sign off on the incident report on time, it doesn't come to us, so we don't see it. And on their side, they think they're submitted, but on our end, we have not seen it. So again, that's something that we continue to provide training and education to the members so they can understand how important it is to report timely so we can quickly intervene if we have to. And that's all I have in terms of events data. And I'm going to pass it over to Matt, who is going to speak on the member satisfaction survey.
Thank you, Gemma. Good evening. As with 2024 and 2023 prior to that, the Quality Department undertook the initiative to complete the annual membership satisfaction survey. We completed 2 different surveys, one for the adult population and the second for the child population. They were broken up into 2 separate groups. The adults utilizing or using the MHSIP survey, which is a validated federally approved survey that we've been using for years in the past that many of the other PHPs also use. Similarly, the YSSF is a validated federally approved survey for children and for families. The survey was distributed on September 1st, and we concluded the survey on the 17th. Sorry about that, my phone froze. Regardless, you'll note that in the demographic section of the presentation that there were fewer responses this year for adults and slightly more responses this year for children. There weren't any particularly different means of collecting the surveys that we employed this year versus the previous year. We continue to go out into the community to ensure that the QR posters are posted inside waiting rooms at all the agencies that we're contracting with. Likewise, for children, we do the same sort of efforts as we do with adults by dropping into different agencies to ensure that we have the right kind of materials that are available for everybody. We did have a slight increase in the amount of mailed in surveys that we had from year previous. I don't have any particular reason as why that may have happened, although it was a fairly large chunk that we received in the mail compared to the year before, to the tune of over 20, which is quite a bit more. Our demographics that we're seeing generally mirror mostly what Macomb County you would expect to see here. We do have for both adults and for children that there are more male participants receiving treatment as opposed to female that respond to the survey, which is something that we would not expect to see necessarily. Typically it is the opposite that happens. And compared to what we have had with one of the other PHPs, Their surveys do reflect that there are more women receiving services than men, so we are a bit of an outlier as far as I was able to find. For most of the age group, we are largely seeing 30 to 64-year-olds are the bulk of what we're seeing for treatment. Likewise, for race, we are seeing that the majority of participants are white, with the second largest population being Black or African American. If we're looking at the slide for the adult yearly comparison, we'll note that all of our demographics or our domains that we're examining here, which is both satisfaction, access to care, quality of care, participation in planning, treatment outcomes, functionings as a result of treatment, and social connectedness. While not every domain increased, we did have most of the domains increase. And largely speaking, as an agency or as a network, our approval rate was 86.97% in 24 versus 87.09% in 2025, reflecting what we're seeing in all the domains as well, that we're seeing increases in satisfaction. For children, we did see a slightly more modest gains in some areas and some significant changes as well. They use mostly the same domains as the adult survey did. We are seeing that for the cultural sensitivity domain and the social connectedness domain, we did see some pretty significant increases in their satisfaction outcomes. Likewise, for their access to being able to see services, we did see a slight decline in that population. However, it's fairly insignificant when compared to the rest of the information that's there. We are noting for the adult population that there was an increase in the amount of individuals reporting that they weren't informed of side effects of medications prior to being subscribed. When I say that, there were 22 responses suggesting that they weren't informed of side effects. However, with there being fewer responses this year, we are seeing a slight increase in the frequency that we're seeing there. That was the main difference that we had from this year compared to previous year with some of the responses that we received. Otherwise, most of the questions are going to be fairly similar to what we've had in the years past. We do see slightly fewer individuals noting that they had a hard time making an appointment with their psychiatrist. However, we did see a slight increase in the amount of individuals indicating that they have a hard time making an appointment with any team member that they're working with. So while there are fewer people mentioning psychiatrists in particular, just general availability of appointments seems to have been a problem for many of our members. A lot of the open-ended question responses that we were seeing also seem to mention particular team members by name. Edna Brown is one of those members that is reported pretty frequently. I think she's had more than 30 responses indicating that they're really happy that she was her case manager. So I just wanted to make sure that she was recognized for that. The year previously, she also had a fairly significant number of mentions as well. We did see that for most of our agencies, we had pretty strong participation. There was a slight decline in some of the CCBHC agencies that we were working with, but not a significant amount. CNS this year did not have any responses. However, the Easter Seals and Judson did not see a particular decline in the amount of responses they had compared to years past. And then lastly, there was one other slight change from the year before compared to this year, and that was mostly that people are more satisfied with individual members that they're working with. I mentioned previously that there are a lot of individual members that were marked by name. However, for children and the adults, likewise, there are more actual responses in the open-ended questions calling people out in particular compared to the years past. There were 35 more responses for that compared to the year before. So I think that's reflective largely of what our team members are doing all across the agency, that they continue to do good work. Any questions?
Questions or comments?
I just have one.
Excuse my voice. I wanted to know on the events data overview, which you did, is there like a beginning and end date for those?
Yes, so all of this is for the past fiscal year.
The
So
past
fiscal
what?
year 25, so from October 1st, 2024 to September 30th of 2025.
Okay,
Yes.
thank you.
You're welcome.
Thank you.
Receive and file, all in favor?
Aye.
Any opposed? Motion carries. Item 7 is resolutions, we don't have any. Item 8, other possible agenda items. 8A is the CEO update.
In front of you, you have the published Macomb Daily news article about the SUD Engagement Center opening. I'm sure most of you have also seen, there was a WXYZ, Channel 7 News was there, and they had a news story. We're very excited about the interaction with the public due to that. If you haven't had a chance to check out the story, please do. It's in your email. It'll also be in your board report 2 weeks from now. But just to give you some numbers, I looked, Tema, I was paying attention, but I looked real quickly because I wanted to see the most recent numbers. I think it's like 2.5 thousand likes on the WXYZ post and like 90 something comments and 400 and something shares. And then what's interesting is we did our own post, which wasn't that interesting before the opening, with just a picture of the building, and that had over 500, I think 94 shares. So there is a definite interest in our community to do some alternative and creative things. And if you haven't had a chance, you guys who do interact with social media, you know it's unusual not to get at some point negative comments or people arguing. It was very few, like 2 out of like 90, right? Which is unusual in social media. So we're very excited about the activities. Thank you all who attended. If you don't notice your picture on there, Donna's in the picture. I think Phil, of course, he's up front with the giant scissors, right? So that same picture, unfortunately for Phil and I, keeps on being used over and over and over again other places. Right, figures they get a picture where we're both like, what? It will also be appearing in, supposedly they're writing a story, Detroit News, so you'll see similar information. And also the Macomb Chronicle, if you're not familiar with it, Macomb Chronicle is that newspaper you get at your house, you know what I'm talking about, like in your neighborhood or whatever. So it's also going to be, at least they reported interest in showing it there also. Anybody who was at the event, please don't feel if you want to make any comments, you're welcome to. If you have not checked out the news story, I really would suggest you do, because they do an excellent job of representing our ultimate goal for this particular service area. Other things, I will stay on the subject, kind of. So we're noticing, I am going to talk about September. So I'm talking about it on a globally kind of as an organization, what we're seeing. We continue to see individuals seeking our help and calling. So just to give you some rough numbers based on that, last September, we had 6,000, I think 200. This September, we had 7,000. I think it was 400. Don't hold me the exact number, somewhere around there. So what we're consistently seeing is that's not a fluke month. Like every month, if you compare month over month in comparison to the last year, or even 2 years and 3 years ago, it just continues to rise. On the positive or optimistic perspective, we're hoping that that's one of the reasons is because we're outreaching to the community. People are asking for help. We love that. The downfall of that is traditionally as our calls go up, that indicates other needs are coming, right? Because that's like the first particular indicator. And there's not enough providers. We can't hire staff fast enough. And that's true not just with us, but all of our partnering organizations. So we predict it to continue to be a need despite challenges being provided by other entities. Also, as a more specific, the calls, if we try to theorize what those calls are about, like what is the increase, it tends to be for SUD and autism. So there's other people still calling about mental health, just to be clear, but those tend to be abnormally large and continuously increasing over the last numerous months. The last thing I wanted to mention to you all, you guys know, I think there's a government shutdown. I think it's today, if I'm not mistaken, right? That it's supposed to be. So just to equate that to how that matters to the people that we serve in lots of ways, but one of them is food stamps, right? So if you don't already know this, I know several of you do, but just in case you don't, if you are in a group home, the way that you have food is you get food stamps. Then the home manager or the provider collects those food stamps, purchase the food, and that's what they use to cook. So in a group home of 6 people, if they don't have food stamps, there's no money to buy food. So I guess I just wanted to make sure people understand, like, when A happens, what that means for the people that we serve. And of course, it impacts lots of other people. That being said, we know we've talked about transportation as an example. We can't be the transportation solution. We can't be the food solution, but we can certainly be a part of the solution. So you'll see no later than Friday, hopefully tomorrow, we're sending out a message it'll be similar to the workforce update, but it'll be a flash update. And our initiatives are 2 different things. One, and again, forgive me if you guys already know this, but you have two situations. You have an individual who is maybe either homeless or find themselves in a situation that they need food, but they can't get to the pantry. So giving them a list of the pantry is not going to do any good, right? So we are collecting non-perishable items. What I mean by, I'm sorry, perishable items, I always invert those. In other words, granola bars, cheese and crackers, those things that like right now, I don't need a stove. Because people, a lot of times when they say pantry food, what do they, everybody brings a canned good. Well, guess what? They don't have a can opener, right? And then they can't cook the food. So again, you'll see it's collecting at all of our locations. Perishables, again, example would be protein bar, cheese and crackers, cheese and peanut butter, something that you could literally take out of the package and eat, and it would be some type of substantiation. What's happening with those is Connie Lasher, who is our lead individual that helps with those experiencing homelessness, she will be collecting those and helping distribute those kind of as a group effort. And then also at our West location, we have our crisis stabilization group, where someone or ACT group, where might be running into some immediate needs, they'll have on them. The concept would be giving them food for today, right? Like, here's your granola bars for today. Then let's get you to the pantry, or let's somehow connect with you with the more long-term. So the second item we're collecting is those non-perishables, canned goods, something you would need a can opener for, or you would need a stove or water or whatever that is. So you'll see that announcement. So if you feel like you want to contribute and help, that is a way that you could do that. You're welcome to dropping them off at any of the locations. You will see in the announcement that we've assigned individuals to kind of like, this person at this location is taking the non-perishables, this person at this location is taking the perishables. We, of course, will also share, and we have on social media, and will continue to food solutions. So again, going back to the concept of, we absolutely want to be part of the solution. We also just can't become the solution, because our area of service is another area. So I'm happy to answer any questions, but that's kind of the concept in order to support our community.
Yeah, not to discourage anybody from contributing, because there's always a need, tremendous need for food out there. But the good news is Bridge Magazine is reporting that as of November 9th, the Department of Health and Human Services, we've had our differences with Director Hertel, but in this case, she's told the vendor who loads the SNAP cards to fully load them for the month of November, both in recognition of what's going on in court and the imminent reopening of the federal government. So that's good. I mean, that should help at least that population. There's a lot of people out there who fall through the cracks. We're finding more and more falling through the cracks with the Unemployment Compensation Agency, because with the shutdown, you know, they're federal employees everywhere. They're not just in DC, and that has getting through to the Unemployment Insurance Agency with questions there's been a huge backlog recently, and they're not able to catch up with it as fast as we should. So there's still a tremendous need out there, and there are a number of those pantries, Tracy, just so you know, that will do deliveries if a person can't get to them. So the chart you put together, and we've been distributing on available food pantries, is really a big help to a lot of. It's amazing how many of the efforts that are going on by faith-based organizations and other private organizations don't know about the other people in their own area. And so they're finding that extremely helpful as well. So good work.
Yeah,
Thank
and our staff are very dedicated group of individuals, right? So they want to do something. Of course, they do it in their own personal life, but we also thought this was an effort way so they feel like they can make a difference, right? Because they want to. They're definitely not a group to sit back and watch things happen, right? They want to be able to be the solution. Yeah, and again, I also think that pantries are wonderful, but there is that gap of like someone walks through our door, or we have staff, remember, that go into the community and they have nothing in that moment. So they can't bring them in their car except for a very small group of people because they're not allowed to. So then we want to be able to supply them with some basic things. And if you don't already know this, our mobile crisis team, for example, they always have like cheese and crackers, and they always have like water and some basic things. Because we all know if you're really hungry or really whatever, you're not going to be ready to ask for help because you're just at the level of I'm surviving, so. Mhm. We have some staff who play some double duty with other organizations that participate in that particular evening. Forgive me, I'm not remembering the point of. Thank you, I just couldn't remember the full name. But we supported it, but we necessarily haven't supplied all of them. Yeah.
Yeah, I just wanted to say that Crossroads has been gathering, I'm sure you probably know, food for probably since the beginning of November. And I know I took quite a bit over there because, obviously almost everyone there gets food stamps and also needs help. So that's another area where if anybody's interested, I know they have a whole room now that's got food. So that's another place where, they're a needy bunch too. So, I've been taking food over there, for the last couple of weeks myself. So, but I'll be more than happy to take it somewhere else.
No, and we don't want to, again, we not want to replace anything. This is just like another way, if people want to participate and they want to give that opportunity for others, they can. We, again, don't want to replace or duplicate in any way. That's kind of the point. And then you also have the holiday season coming up, right? So that's challenging for many. We are not doing this permanently. We will do like the mobile crisis bags, right? But I believe, don't hold me to the date, when I want to say like December the 17th. So this is just a period of time to collect, because again, going back to, we can't be the solution. We don't have the space. We don't want to be the food distributor, essentially.
Okay, thanks, Tracy. Any other questions or comments? All right, just a few reminders. There is a full board meeting. This month will be Tuesday, November 25th, at 6 o'clock here. There is no program and budget meeting scheduled for December. Full board meeting in December will be Wednesday, December 17th at 6 p.m. Following day, Thursday, December. To address the board. Any board members have anything they want to add? So moved. Motion by Megan, support by Sharita and Julia. All in favor? Aye. Any opposed?